Okay, time to test yourself. This has been quite the journey through metabolism. There are lots of enzymes, pathways, and disorders that you'll need to know for the test. Make sure you're comfortable with the material that we've covered so far, so you don't miss any of the easy questions. Let's do some practice ones here to demonstrate how biochemistry metabolism questions could appear on the USMLE. I chose some hard ones here to make you think a little bit, but rest easy. Not all the questions on the USMLE are going to be this difficult. Okay, now for the first question. In a healthy individual, fasting leads to increased lipolysis, increased accumulation of fatty acids, and increased production of acetyl-CoA. Acetyl-CoA is an allosteric activator of an important mitochondrial enzyme that catalyzes the rate-limiting step in gluconeogenesis. What's the product of the reaction catalyzed by this enzyme? I'll give you a bit. Do 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 do. I hope this song isn't copyrighted. Okay, so if you chose D, or oxaloacetate, you'd be correct. But let's take a look at why this is the case. The question is simply asking, how is gluconeogenesis regulated, and what's the product of this step? Remember from our conversation of fatty acid metabolism that fatty acids get converted into acetyl-CoA. Gluconeogenesis occurs mainly in the liver when the body wants to create glucose, like during the hypoglycemic or fasting state. To make this glucose, the body needs to reverse the glycolysis pathway. Many of the enzymes in glycolysis are reversible, except for 3 irreversible steps. Gluconeogenesis uses 4 unique rate-limiting reactions to bypass these irreversible steps. A molecule of pyruvate is first converted to oxaloacetate by pyruvate carboxylase. High acetyl-CoA levels allosterically activate this step. When there are high levels of acetyl-CoA, pyruvate carboxylase will start converting pyruvate into oxaloacetate, and gluconeogenesis can proceed. Okay, second question. A 55-year-old man with recurrent arthritis of both knees presents to his primary care physician for a routine checkup. Results of urinalysis are negative, but the nurse reports that the urine sample turned dark on standing. Levels of what substance will most likely be elevated in the urine sample from this patient? Think you got it? Okay, so the correct answer here is D, homogentisic acid. This question gives some good clues to what this patient has. First, the question says the patient has recurrent arthritis. Also, his urine turns dark. These two findings together suggest L-captonuria, otherwise known as ochronosis, which is the result of defective tyrosine amino acid degradation. The enzyme missing is homogentisic acid oxidase, which converts homogentisic acid to mallyl acetoacetic acid. Therefore, high levels of homogentisic acid leads to black urine and arthritic damage. Okay, ready for one more? A 6-month-old boy is brought to the physician because he seems smaller than other kids his age, and has the occasional episode of vomiting associated with bottled milk feedings. He was born at home and didn't undergo newborn screening. On physical examination, the patient is found to have jaundice, bilateral clouding of eye lenses, and hepatomegaly. The patient also shows signs of developmental delay. Which of the following enzymes is likely to be defective in this condition? The defective enzyme here is C, galactose 1-phosphate uridyl transferase. The question prompt gives us all the information we need to figure this one out. Here, a 6-month-old presents with vomiting after bottle feedings. He had no newborn testing, so he may have one of the commonly tested inborn errors of metabolism. This boy has jaundice, lens clouding, hepatomegaly, and developmental delay. With all of this in mind, hopefully you're thinking classic galactosemia, an autosomal recessive disease that's caused by a deficiency in galactose 1-phosphate uridyl transferase. Recall that there are essentially 2 galactose metabolic disorders that you'll need to remember for step 1. The milder form, galactokinase deficiency, may present with infantile cataracts, but usually not developmental delay because of its benign nature. Therefore, I'm more inclined to think classic galactosemia in this case. Galactose 1-phosphate and galactitol will accumulate in the organs, causing damage. Notice how the question said that vomiting occurred primarily after milk feedings. Milk has lactose, which is a disaccharide that gets broken down into galactose and glucose. Therefore, the treatment for this kiddo is a lactose and galactose-free diet. Okay, next question. A 2-year-old boy presents to his pediatrician with hepatosplenomegaly, failure to thrive, and progressive central nervous system deterioration. Liver biopsy shows that hepatocytes and Kupffer cells have a foamy, vacuolated appearance. Unfortunately, the pediatrician suspects that the boy will die by 3 years of age. Which of the following is the function of the metabolic enzyme deficient in this patient? I'll give you a little bit, because this one's a little tough. In this question, we expect you to figure out the deficient enzyme and what reaction it undergoes. Let's first figure out what disease this question is referring to. Looking at the answer options, we see 5 possible lysosomal storage diseases. We see hepatosplenomegaly, which immediately rules out a few of the possible lysosomal storage diseases. Do you remember which ones have hepatosplenomegaly? So these are going to be Gaucher, Niemann-Pick, and Hurler. So we've narrowed down from all of the lysosomal storage diseases to only 3 possible choices. The next major clue for me would be the description of the liver biopsy. Here, the hepatocytes and Kupffer cells have a foamy, vacuolated appearance. Does this sound like they are trying to describe a foam cell to you? Well, in Niemann-Pick disease, foam cells are a key buzzword. Okay, so we've now determined that the boy has Niemann-Pick disease, but that's only half the battle. Now we need to figure out what metabolic enzyme is missing. Do you remember how we can remember the Niemann-Pick enzyme? Remember that you pick your nose with your sphincter. So sphingomyelinase is missing, which converts sphingomyelin to cerebroside. Sphingomyelinase deficiency causes sphingomyelin to accumulate, so option E is our correct answer here. What other buzzwords might we see with Niemann-Pick? If I heard foam cells, Ashkenazi Jew, cherry red spot, or hepatosplenomegaly, I'm thinking about picking my nose with my sphincter. Sounds silly, but trust me, it works. The lysosomal storage diseases are a hot topic on boards, so make sure you know them in and out. Okay, last one. A 30-year-old previously healthy man is seen in clinic several weeks for follow-up after a bout of pancreatitis. The patient doesn't drink alcohol and has no history of gallstones. He's neither obese nor diabetic. In clinic, blood is drawn and is milky white in color. Which of the following likely explains the pathophysiology of his underlying condition? I'll give you a little bit. The correct answer is C, a lipoprotein lipase deficiency. This patient most likely has type 1 dyslipidemia, also termed hyperchylomicronemia. In this disease, there's an excessive amount of chylomicrons in the bloodstream. This can cause a milky white appearance of the blood due to high triglyceride levels. Also, hyperchylomicronemia can cause pancreatitis and hepatosplenomegaly. Do you remember what the 2 causes of hyperchylomicronemia are? It can be caused by a deficiency in lipoprotein lipase, which is typically found on capillary walls. It helps digest chylomicrons by cleaving triglycerides into free fatty acids. Lipoprotein lipase also requires a cofactor, ApoC2, which is found in chylomicrons. If there's a decrease in ApoC2, there could also be hyperchylomicronemia. If you were to run a lipid panel on this patient, you'd suspect his triglyceride levels to be elevated, often in the thousands range, and this is going to be in milligrams per deciliter. However, his LDL and HDL levels should be normal, assuming that there's nothing else going on under the hood. Well, that's it for the biochemistry section. Thanks for putting up with my shenanigans, but I'd really like to congratulate you folks for putting in the time and effort to do well on your USMLE Step 1 exam. It'll be worth it in the end. Trust me. Cheers, mates.